It's Pennsylvania Newsmakers, and as always, thanks for joining us. Well, it's an issue in our state and in our nation as well, emergency room overcrowding. But first, highway construction is booming. What else needs to be done? Back after these words.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, I'll tell you something you already know. You can't go anywhere in the state of Pennsylvania, travel on any road and not find some kind of construction that causes delays, but it's extremely important that this construction continue and that it be efficient and well done. Joining me to talk about the construction industry is Bob Latham. He's the Executive Vice President of the Associated Pennsylvania Constructors. Bob, welcome back.
Good to be with you.
I'll tell you, the construction industry has a good year, but I'll tell you, I don't remember a time when we've seen so much construction as I travel around the state.
Well, we're in year 3 of the federal bipartisan infrastructure law, or the Jobs Investment Act of 2021. I've increased PennDOT's funding from the national level by about 20%. So we have seen unprecedented work. There's a lot of money available right now, and we'll talk about the future a little bit. But you're right. We're fixing our bridges. We're fixing our roads, particularly focused on preservation. So the reason you're seeing while you drive the work is because there's not new highways being built, right? It's all reconstruction, rehabilitation of our system. As you know, the interstate system is 60 years old. The average bridge life is 50 years. So,
and you also have additional monies that were originally going to the state police now flowing into the transportation industry.
Governor Shapiro and our legislative leaders on both the House and Senate side have agreed that it's time to find a new way to fund the state police.
We want them funded. We're not saying don't fund them.
That's why we say a new way to fund the state police fully. And it's come to fruition in this budget cycle, where a new public safety fund is what it's called over in the general fund has replaced the decades-old practice of siphoning off gas tax money, motorist transportation money, and putting it into the operations of the state police. And just to give you an idea, just some 6 years ago, we were taking $800 million out of the highway program, which is equivalent to about 11 cents of gas tax money that wasn't going into road construction. That has whittled down. This year, we're down to about just under $400 million, which doesn't sound like a lot, but it is. It's very significant, and the glide path is down to zero. And we've been, we've been assured in this budget process that this will continue into future years.
And we're talking about big money when we talk about this. You say $500 billion in highway construction money.
Right. That's what's eventually going to be available to the program through a combination of this money back to the state from the state police as well as the federal funds.
And no gas tax hike.
Well, no. But we're going to have funding issues to face into the future. The federal bill caps out after 5 years. There's uncertainty as to what's going to happen with that, and as you know, the fuel-driven cars are more efficient. There's more and more of a drive to push for electric vehicles. And as that all intersects, what happens is the gas tax revenue goes down, our buying power goes down, but our needs for rehabilitating our roads and bridges isn't going to change.
Yeah. All right. So it's an important change that's taking place that is not just in terms of efficiency, getting people to be able to travel, but it's about safety as well.
Exactly. So, and it's about commercial movement. you say you can't drive around without seeing a highway construction site. You also can't drive an interstate without seeing a $1 million square foot warehouse on the side of the road. Yeah. Well, something's going in and out of those warehouses, and they're 80,000-pound trucks. And so moving all that along our interstates and how we adjust to the distribution economy is what we have in our state today. And how that gets funded is a question for policy leaders in the future.
You have some issues involving your industry in the Pennsylvania legislature. Let's run to a break, and we'll chat about them after the break.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
All right, Bob. Well, you have initiatives before the Pennsylvania legislature dealing with highway construction. What are some of them, and why are they important?
Well, what we saw during the pandemic was a marked increase in speeding, reckless driving, and unsafe practices by motorists. At the same time, we saw a proliferation of commercial vehicles and a huge increase in the number of trucks on our roads. And the confluence of the two of those are making it very unsafe for highway construction and highway construction workers.
And if you want to know for the drivers,
if the viewers want to know what it's like to work on the roads, just pull over on an interstate sometime, safely off the road, and just get out of your car and stand and feel what that's like.
Oh man, I can't imagine.
It's very, very difficult. What we're trying to do is get motorists to slow down in highway work zones. It's a safety imperative for motorists, but also for the highway workers. So we implemented a few years ago a program where there's automated speed enforcement. We're trying that legislation needs to be renewed, a sunset taken off of it. We're working very hard on that. We want to make some changes to that. Right now there is a first warning system, which I think people realize, and so they tend to ignore it. When we see states like Maryland and other states that have a first offense fine, which there's a very reasonable low fine of just $25 in the current legislation, we think that that's appropriate in order to get people's attention. So we're hoping to get that bill reauthorized here in the fall session, so it won't expire in February. The most important thing is to get it reauthorized so that folks know. And there will be ample signage. There's ample warnings everywhere. The speed enforcement zones are on the internet, and so nobody should be caught unaware of the fact that the cameras are going to catch you if you speed through work zones.
I've asked you about this before. I'll tell you, I drive a good bit, and I've never seen so much reckless driving with people passing where they shouldn't, cutting you off, and the other thing is people holding these. You can see them looking at them while they're driving. Right. I mean, and how dangerous that is.
Well, that is. I mean, the statistics are there. You go if you're at highway speed, you're going to go about 300 yards in just under a couple of seconds. I mean, that's too hard to react to if you don't know where you're going or what's in front of you. So it's very important that motorists put, as they say on the turnpike, hands on the steering wheel, phones down.
Yeah.
Slow down, phones down.
Yes, I like that expression. Slow down, phones down.
And just a last thing on that. Pennsylvania has the third highest number of worker fatalities in the country. And it's really just unacceptable. It really doesn't have to happen. The barriers are there.
Sure.
The markers are there. People just need to pay attention and slow down. And we think the speed enforcement bill will go a long way in that regard.
All right, let's talk about electric vehicles, and I can't say they're the future because they're here now.
Well, we opened the segment with the fact that we have a lot of road construction going on, and that's true. But the future is uncertain as far as highway funding. It's mostly paid for by a gasoline or fossil fuel consumption tax. As we go away from consumption of fossil fuels, it's not hard to understand that our basic funding source for infrastructure and particularly transportation infrastructure is going to go down. Right now, if you own an electric vehicle, you do not pay anything akin to what the average motorist driving a gasoline-powered car pays in Pennsylvania. Some 25 states have already recognized this. They have a commensurate registration fee. There's been legislation around for years.
In the Pennsylvania legislature?
It's been in and out for like 2 or 3 sessions. It just never passes. And it's very important that the governor and our legislative leaders once and for all pass a reasonable...
Well, what do they say when you go and chat with them about it, about why they're not moving the bill?
The arguments are it's too, the fee's too high, the registration fee's too high on the one side. On the other side, it's too low. There are people that say, well, that would disincentive folks from buying electric vehicles. Well, electric vehicles are now, first of all, you get a $7,500 tax break from the federal government. The state has just awarded Sheetz $35 million to install charging stations. So there's all kinds of federal and state subsidy on these vehicles, which are, quite frankly, more expensive than gasoline-powered cars. It's time for people to pay their fair share.
All right. Well, thanks for coming in and providing us with this very important and helpful information. All right. Coming up, you want to talk about important subjects, the emergency room. May we never have to use it, but if we do, guess what? Overcrowding. It's a serious problem. That will be addressed after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, we don't think about them until we need them. I'm talking about emergency rooms, and they're having a series of very important problems we're going to chat about with Dr. Kristen Sandel. She is the president-elect of the Pennsylvania Medical Society. Doctor, welcome.
Thank you. Thank you for having me.
I'll tell you, am I right about that? Who thinks of emergency room, an emergency room until you need it? Someone in your family, you rush in there, and all of a sudden, they're critically important.
Yes, emergency medicine is one of the newer specialties in healthcare. We've been around for about 50 years.
Wow.
But we're the safety net of healthcare. We're open 24/7, and we're there to treat patients, whatever their medical needs are.
Yeah. So let's talk about overcrowding. It's a significant issue. I think you've described it as a core issue. What's the issue right now with emergency department overcrowding?
Emergency department overcrowding has been an issue for decades, and it's something that emergency physicians were well aware of even before the pandemic, but has certainly been an issue since the pandemic as well, and even more so since the pandemic has decreased in the last few years. What we're seeing is an increase in the number of patients that are not only utilizing the emergency department for their medical needs because of access to care issues and increased mental health and substance abuse issues, which we really saw skyrocket during the pandemic. Yep. The other issue, though, is ED boarding. And boarding is when patients are admitted to the hospital, but they need to stay in the emergency department because there is not an appropriate bed available in the hospital or a bed available at a transfer.
So it's an interrelated problem.
Correct.
And you also have staffing shortages?
We do. Since the pandemic, we saw a lot of our healthcare providers, whether that's nurses, nursing assistants, physicians, and advanced care professionals, have left the profession or are retiring early. So we saw a significant decrease, especially in nursing and nursing assistants, over the past 3 years, from 2019 to 2021. Significant decrease in the number of staff that's available to provide that care to patients in the hospital setting.
And hospital closures and hospital problems lead to situations where you probably get more patients than you otherwise would. Is that true?
That is true. We've seen hospital closures, a significant number of hospital closures, specifically in Pennsylvania over the last 5 years. And when you have those hospitals closing, especially in patients' communities where they are used to seeking care and they feel comfortable with that care, patients need to seek care at alternate sites. And so some of the hospitals in those surrounding areas where hospitals had closed are now seeing an increased number of patients and an increased crisis in boarding.
Point. Yeah. Well, why is it that hospitals and physicians aren't fixing the problem? I mean, there's obviously they'd like to see it fixed. I don't think there's any doubt about that.
I think this is a problem that spans the continuum of healthcare. This is not just a hospital problem. We do see many patients that need care in a less acute setting. So whether that's in an extended care facility, we see a lot of older adults, increasing number of adults with dementia that require care that don't necessarily need to stay in the hospital, but they can't go home.
And we're seeing a lot more news about dementia and Parkinson's and those two problems in particular, and I'm sure there are others.
Yes, like I mentioned before, the behavioral health patients and patients that require psychiatric needs acutely, and also the substance abuse issues, so patients that require rehabilitation facilities. Those patients are coming to the emergency department to seek help because, again, we're open 24/7, and we're there to treat the patients, but we also need a place for them to go. And so when we're talking about emergency department overcrowding and boarding, this is not just a sole hospital issue. It involves a large number of other community partners in the healthcare.
Yeah, and obviously it's been hospitals and physician groups. It's fixing the problem isn't easy.
Correct, and that's why we started the task force. So we have a task force that started in spring of the Pennsylvania Medical Society, and that came from a request from a physician going to our board chair and saying, what can we do about this issue? We've been talking about this in the emergency medicine world for decades. The Pennsylvania emergency physicians have talked about it, and we decided to get a task force together with a multidisciplinary number of physicians. So not just emergency physicians, but physicians from psychiatry, physicians from family medicine, internal medicine, and also some other stakeholders to say, what can we do as a community, a healthcare community, to start solving this issue? And we've asked Governor Shapiro to start looking at this from a statewide level. Okay.
All right, we're going to run to a break. When we come back, we're going to see in the post-pandemic stage, although it looks like we're having more COVID back, COVID's back, is it still overcrowding? Is it still a significant issue?
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
I tell you, the pandemic stage of COVID-19 is over. So has that made a difference in terms of emergency departments and in their staffing and in their ability to deal with patients? Put another way, is overcrowding still an issue?
Overcrowding is even more of an issue than it was.
More of an issue.
Correct. So during the pandemic, we saw many patients come in with COVID conditions, but what we weren't seeing was patients coming in with other conditions that weren't related to COVID because there was fear in the public of going to hospitals at that time. Yeah. Now that the pandemic has been winding down, although we are seeing COVID numbers creeping up recently, we are experiencing significant overcrowding. They did a survey of emergency medicine chairs, and they found that 83% of them thought that it was actually worse than pre-pandemic numbers. Yeah.
Yeah. Well, the other thing it seems to me is that you're talking about staff that includes more folks than just physicians, with all the staff assistants that are there. And every place I go, you know, you can drive around any town, any village, anywhere, and what do you see? Help wanted, help wanted, help wanted. So you're not describing a condition that's unique to the healthcare.
Healthcare is a team sport. You know,
good way to put it.
It's a team sport, and it involves a number of different you know, people involved in that team, and that's both clinical and non-clinical. We can't run a hospital without our environmental service workers. We can't run them without a cafeteria workers.
Good point.
And so, you know, whether it's a physician shortage, nursing shortages, but also shortages of our non-clinical staff, it really takes an entire team for patient care. And when we're seeing these shortages, and like you said, help wanted, whether it's at a restaurant or whether it's at a hospital, we're seeing a lot of that.
And the overcrowding problem creates a situation with the patients as well.
Yes, you know, patient care, it suffers when there's overcrowding. You know, it's been well studied that patients that are admitted but are boarding in the emergency department and are waiting for a bed upstairs have increasing issues with safety of care and with quality of care.
Good point. All right, I have to ask you this question. How do you fix it? What can be done to fix the problem?
So this is not a problem that's going to be fixed tomorrow, and it's probably not a problem that's going to be fixed within the next month or the next year. This is a problem that is going to require a significant number of stakeholders that all come together and work on this piece by piece. It's so multifaceted. There are so many pieces to this that need to be worked on. But I think that's why we have the task force. We want to take a look at it. We want to take a look at it from a state level, not just from emergency physicians, but from physicians and from healthcare associations.
Will you be making specific recommendations on how to fix the problem?
The first ask was just having the governor take a look at this at a statewide level, and then we are certainly willing to be partners with the governor in this and making those recommendations. You know, I think the first thing is getting the stakeholders together to see what we can do immediately, but then also, you know, on a more long-term basis to see how we can solve this problem, you know, using all of our resources.
Are you optimistic that this problem, as you point out, it's not going to be fixed in the short run? It's a long-term problem that's probably going to require a whole variety of groups and individuals to get involved to solve the problem, right?
I am optimistic. I think that, you know, we are getting a lot of traction on this. We're getting a lot of traction from, you know, from people like you inviting us here to talk about the issue. This is an issue that affects everyone in Pennsylvania, whether it's you as a patient or whether it's a family member or a friend that's in the emergency department. And it's something that I think is near and dear to a lot of people's hearts. And I'm hoping that Governor Shapiro feels the same way, and that we can certainly work with him and partner with him to solve this issue and to at least make it better going forward.
Thanks for the update. Very important. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.